Talking about the specifics, for example, one of the things that we handle here is the diagnosis of patients who have PCOS, that is polycystic ovarian syndrome. So when it's actually a pelvic examination that you do for women. Now, most times these women are not able to conceive, or they're not able to see their periods as at when due. So these women are kind of worried, and when they come to the department, they are sent to various tests that they can do to make sure that we properly diagnose what is the cause of them not conceiving or giving birth. So when they come, we first of all do a trans-abdominal scan where we use this probe. This is a linear probe. We use this probe to first of all do a trans-abdominal scan of the pelvis area. So what we are checking there, we are checking the uterus, we are checking whether it's bulky or not bulky, we are checking the ovaries as well, if the follicles are growing properly or if they are dominantly located in the ovaries. Then after we are done with the trans-abdominal scan, if the trans-abdominal scan does not give us a proper diagnosis, or there is just some things that are still missing out in the scan, then we'll now move over to the transvaginal scan. And in the transvaginal scan, we use this probe. This is a transvaginal scan probe. Now, what do we do with this probe? This probe is like the name, transvaginal. It goes into the vagina. What does it do? It accurately diagnoses the inside of the uterus. Okay, so the patient comes and then you coat it with a latex and then you insert it into the woman's or the female's vagina and then straight to the uterus. So what it does is we are able to visualize the entire uterus and also the ovaries. Now, visualizing the ovary will now enable us to know if there are polycystic ovarian syndrome in the ovaries. Now, how does this appear? Whenever a woman has a polycystic ovarian syndrome, there is usually a spiral location, a spiral form that the ovaries, the eggs are located. So it positions itself in a spiral form around the ovary, and they are not going anywhere. They're just there. They're just dominant. So that can cause pain depending on the size of the cyst. That can also cause the woman to have fluctuations in her menstrual periods and cycles. So, but when they come here and we're able to detect it through the ultrasound scan, then the doctors can now know, okay, we have confirmed that this is a polycystic ovarian syndrome. This is now what we are going to do. This is how we are going to make sure that we treat this particular thing so that this woman can be able to conceive again and be free of pain. So that is one of the exams that we do here in St. Mary's Hospital.